All right. So we are live. So welcome everyone. This is an Aspen Dental Ask Me Anything where you get to ask us the questions you want. And then we also have an option to interview because we do have openings in our Portland area. So we've got two wonderful people with us today. We've got Natalie and Holly, both dental hygienists that have worked around the area. I'll let them introduce yourself. Natalie, why don't you go first and tell us a little bit about yourself?
Hello, I'm Natalie. I work at the Vancouver, Washington Aspen Dental. I've been there for just shy of 2 years. I have two boys, so outside of work, I'm usually taking care of them and usually at baseball games.
Oh, that sounds like fun. It looks like perfect baseball weather outside.
Yeah, it's pretty nice today.
Holly, why don't you introduce yourself and tell us a little bit about your experience?
Yes, so my name is Holly Walker. I am currently the territory manager of hygiene support for the Pacific Northwest, which is Washington and Oregon, and then Northern Idaho. When I was clinical with Aspen Dental, I worked in the North Spokane office for about 2 years. I currently live in Spokane, so I travel all around and I just help to support the offices and the hygienists there. And in general, I don't really do anything too crazy outside of work, but I have two little puppies. So we like to stay active with them, go hiking, stuff like that.
I was going to say, I knew you had one puppy. Did a second one pop up?
Yeah, we just got him. He's 9 weeks old. We don't sleep. So,
Oh,
well, congratulations. You guys, between puppies and kids, you guys are staying busy.
yeah.
Let's go ahead and get right to the questions that the students have for us. It's great to have two people that have worked clinically with Aspen or do currently work clinically with Aspen, because you guys are the ones that are really going to be able to share the information that students want. So Natalie, talk to me about why you chose Aspen Dental. We all know that dental hygiene is a profession of choice where we have a lot of choices. So why Aspen for you?
it was just a perfect fit. It fell right into my lap with the job opportunity popping up right as I got my license, and it was close to home. I wanted something full time. I wanted to have the benefits and the, paid vacation and sick time, because as a mom, that's important to me. When I interviewed, I loved the team. Everyone was so sweet. And I really, really loved the atmosphere and the overall goals of Aspen and providing care and breaking down barriers to people that may not be able to receive care elsewhere. And it just has been a great fit from day one. So I couldn't say no to the opportunity.
I love hearing that. That's fantastic. Yes, I agree with you that breaking down the barriers is like that thing once you're in that you're like, oh, they're serious. Like we break down barriers for patients and
Yes.
work hard to do that every day. So we really appreciate you. Holly, I know it's been, you've been with us for 2 years too or more, right?
Yeah.
So think back in the day, what was it that originally brought you to Aspen?
So I interviewed just a whole bunch of different places. I wanted to keep all my options open. And when I interviewed with Aspen, one thing was I really wanted to work initially in a community clinic. So I wanted to help those patients that can't afford care. They really needed it. And where I lived, they didn't have any opportunities to work in them. And when I interviewed at Aspen, my regional manager told me, we see a lot of patients who haven't been in 15, 20 years, who are scared, have anxiety. And it just seemed like the exact environment I wanted. I wanted to see those patients that were asking for help and who wanted to be seen that day and to get their care. And then also just for my own personal growth, I wanted to be able to do, other things with my license. And the company has so many opportunities in that now I'm a territory manager. So I wanted that career growth opportunity if I chose to not be clinical anymore.
I love that. So it was a twofer. You kind of saw the kind of patients you wanted to treat and your future and how you wanted it to look. So that's super awesome. Now you both mentioned benefits a little, so I always like to dive in. Natalie, what's the benefit that you find that you use the most, or is that the most useful for you?
That's a tough one. I think just having the opportunity to, I'm going to list all of them probably, so I apologize. Having retirement was important to me because I have a family and, long term, I needed to have that opportunity. Like I said, sick time, vacation time with baseball. My son plays on a travel team, so we're traveling a lot, and I wanted to be able to have the flexibility with my schedule. And then, just there's so many great benefits. I could go on and on with what Aspen offers. It's a really great opportunity for hygienists.
I'm right there with you. I had a great private practice experience. I'm not here to dog private practice if that's what people want to do, but health benefits were more important than I thought, especially when my spouse got sick and I needed to be the person that carried insurance. So that was huge. And oh my gosh, the PTO, I'm sorry. I live for being able to take a holiday when a doctor's not on vacation, because I used to have to take it when my doctor went to Cabo. We all took vacation at the same time, and that was the rule. And if you took it at another time, you didn't get paid, and you had to find your replacement if you were going to do that. So every holiday or anything extra that I had was like really stressful. And now it's just like, oh, I'm going to take that day off because that's the day that I want to take off. And
that was very important to me. I did interview somewhere and he said we get 2 vacations, 2 or 1 week vacations. And I choose when those times are. And I knew automatically, again, to each their own, but that was not the right fit for me. I needed to be able to have that PTO.
You were wiser than me. I thought I could totally do that. Holly, what about you? What do you find yourself using or liking the most as far as benefits go?
Like Natalie said, the 401k, my dad beat it into my brain that I'm never going to get Social Security. So, he was like, it's going to run out by the time that you need it. So, definitely the 401k, just because one day I would like to retire and I'd like to keep living my life the way that I do now without having to work. So, definitely excited for that. And then, yeah, just in general, the healthcare benefits I can't see. So I definitely need my eye vision insurance. But just in general, and the PTO, the vacation time. And I also feel like, I'm not really sure if it falls into the benefits category, but a lot of our incentives and everything, those are huge to me. There's just a lot of things that you're able to, with the PTO, vacation time incentives, you're able to work less hours and get paid the same. And you get to have that nice work-life balance at the end of the day. And I think that's what everyone strives for and wants. So.
Are you the daughter of an accountant too?
I'm not, but my dad is just very.
I'm glad. I hope my dad doesn't watch this because he would be so disappointed that I didn't say it was the 401k. He's a CPA and that's his main thing in life. All right. So I'm getting you'll see me looking down here. I'm getting some good questions coming in. So it'll go a little out of order, but we're going to get some good one answered. So the first one I've got is that I'm curious about Aspen and how the company interacts with the queer community, particularly in respect to respecting pronouns and trans-sensitive care, because it's personally important to me. Natalie, go ahead. Tell us, I know you and I were chatting earlier, tell us what you've experienced with Aspen in those terms.
I think Aspen is really great at just opening our doors and arms to anyone and everyone. We definitely are not a company or my team in particular, we do not discriminate. We respect everybody. I mean, we might make mistakes every now and then, but it would never be intentional or to hurt anyone. I had a situation where this had come up at work and I just very respectfully asked the person what they prefer to go by so that I could make sure to respect their wishes.
Absolutely. Part of breaking down a barrier for a patient, I would say, is making them comfortable, right? So people are comfortable if you don't recognize who they are. So I think that's the way. I hope everyone is, but I know particularly at Aspen. Holly, anything to add there?
Yeah, so whenever we have something really great happen, we call it a yes story in offices. And I actually just learned about one yesterday. There was a patient who had come in and they were, I don't know, I don't want to mess up the term, but they were transitioning into becoming a woman. And so they went by she, her. And one of the dental assistants actually was really respectful and really sensitive to that. And when that patient left the office, she actually called back and asked for that dental assistant by name. And she wanted some advice for going shopping and buying things. So yeah, it was
I
really
love
touching.
that. I love that. So they want it on a personal level, not just a professional level. I absolutely
Yeah.
love that.
Yeah.
That warms my heart. And I have to say, you know, having family and the community, it's really, really important when somebody recognizes you for who you are and then even shares common things. So I absolutely love that. I would be useless though. I'm not much of a makeup person if they were looking to buy makeup.
Me either.
I'd be like, I found the wrong person. All right, so let's see what we've got next. What sort of comparison to average does Aspen have for benefits and pay? So we talked a bit about benefits, but and please don't feel like you need to share your exact income. You know, I know that's personal, but can we talk a little bit about our compensation model?
I definitely feel like we have very competitive wages, and even starting as a new grad, I was very happy with where I was able to start. And I know Holly kind of mentioned the incentives that we have through Aspen. That's a great opportunity to, if your hygiene business is doing really well, you do get compensated for it. So that's one of the lovely things about Aspen Dental.
And if I'm understanding right, where you're at, it does pretty darn well.
I would say we do pretty good.
I was like, I've heard some rumors. So
Yeah.
for you. Holly, would you feel free to talk about the model?
Yes, yeah. So, I mean, you have like your base salary, which I agree with Natalie. It's competitive. We try and keep up with everyone. We obviously are realistic about it, you know, and we put you like through like a growth model. So as you are more experienced and things like that, and you know, your hygiene business is growing, we also recognize that and compensate you for that. But the incentives just really help. And like Natalie said, you know, it's not all about money, but at the end of the day, like you have to live and you have to, you know, bring home a paycheck. And Aspen definitely recognizes those who are working really hard, really growing their businesses, things such as that. And I see this every day as a territory manager. I mean, today I was on an email thread. A hygienist felt like she was doing a really great job. She felt like she was driving her business. She was driving patient care, and she got recognized for that and compensated appropriately. So I feel like, you know, you're not ever just going to like hit that glass ceiling. There's always room for growth.
I love that. Yeah. And I can't emphasize enough that you do have that strong hourly too, plus the gross profit incentive. Unless if you start as an associate, you actually get a direct percentage, but when you plus your hourly wage. But if you start as a lead, you get that gross profit plus. And it really just depends on what the office needs, but both are very good as far as I'm understanding. Have either of you been an associate before, or did you both start as leads?
I was the lead.
Me too.
Perfect. Perfect. Well, the associate I know is a flat 3% plus the hourly that the person gets. So in my experience, you know, it really depends on how the practice is going. I don't want to say anything like in depth, but I would see averages of like 1,000 to 1,500 when I was looking at associates. Would you say that's kind of where you are, Holly?
Yeah, it definitely depends on the practice. And there's different, you know, like part-time, full-time, things like that. But yeah, I'd say it's like right around there. And it ranges based on the office. I mean, we have hygienists who are basically doubling what they make in incentives because they're just thriving. And it definitely is, it's 100% what you make of it. What you put in, you're going to get back out. And I'm sure Natalie can agree with that.
Definitely.
I love it. That's one of my favorite things because I was always the person who worked really hard, you know, and I always wanted to be, I've always hygiene didn't allow for my workaholism to do anything to my advantage until I met Aspen. And then I was like, oh, like this works for me. Like the more I do, the more I get. That's wonderful. And the more and most importantly, the more patients that get care, which was always what we're looking for. So I'll read this question and then I'm going to kind of say what I think it means. And if it says, does the culture of Aspen lean more towards modern or traditional as far as patient care goes? I'm going to I'm thinking there, and you can correct me if I'm wrong, that they're asking like, are we more like conservative or aggressive with patient care? Holly, I'll let you go first there.
So I definitely think that Aspen is what I would call realistic. So I think that the hygienist, I mean, a lot of the doctors allow the hygienist to say what treatment they believe that the patient needs. Obviously, hygienists can't diagnose, but they do allow them that freedom to say, I see this, I believe that the patient needs this. And I believe that you're able to treat exactly what you see. So Aspen doesn't let any barriers such as insurance, finances, time, anything like that prohibit the patient from getting the care that they need. So I would say, if anything, it's probably more on the modern side because they're following all the new AAP guidelines. They're bringing in treatments such as like locally applied antibiotics and lasers. So they're keeping up with the times. I wouldn't say if they're like anyone's necessarily like aggressive, but they're definitely treating what is actually going on instead of what the patient wants done or what their insurance is going to cover. They're being realistic about there is disease, we're going to treat it.
Yeah, no bloody prophies here.
Nope.
I always say you're really going to give patients what they need. And I think the culture really supports that. We have a lot of systems set up so that you and your dentist can work together to make sure that there's really a standard set in the office so that you don't get questioned later. Like, why did you do this? You can say, well, according to the standard that you and I set together, this is this. So I think that's really helpful. I would say I'm going with modern too in my thought, because it always seems like the dentist respects the hygienist as a clinician here, and more than I've seen anywhere else. I always felt like I was, and I loved my private practice. I please don't think I'm dogging on them because I absolutely love the people. There were just things culturally that just weren't a fit for me. And one of them was that I didn't feel like I was the clinician in charge of perio. I felt like I was like an adjunct to what was happening perio wise. And I feel like at Aspen, the hygienist really is the one that's in charge of perio, and the dentists usually are just like, yeah, I'm right there with you. Like, your stuff. So I really love that. Sorry, I really jumped in there because I'm super passionate about it. Natalie, anything to add there?
No, I completely agree. I think it is very realistic. Just personally, I have a friend, a colleague who works at a private office. And again, I'm not trying to dog them either, but she does not have the autonomy or the ability to provide hygiene treatment planning. She's basically just, has to do what the doctor says, and it's not always what she agrees with. So that is one of my favorite things about Aspen is that my doctor and I have a great communication level and are on the same page, and she will back me. And we are just always, providing the best care for what the patient needs, not based on anything else.
I love that. It's a lot of freedom. It's like that's the anxiety of when I would have to say like, no, I really think this is this, it's gone. I know that that's not going to be an issue. So yeah, I love that. I think that, and I'm right there with you, not trying to dog my private practice experience.
Not at all.
It's a lot different in that way for sure. And it was confusing because I was a new graduate. So I was like, I know that perio is this, but you're saying perio isn't this, and you're a doctor. So I was just getting confused in my own head, and it actually made me regress because I started to doubt what I knew. You know what I mean? And then it took a couple things for me to realize, wait a minute, you know what you know, you've got this down. So really, really good answers there. So I've got another one here. You see me looking down. It says what are the most, okay, I like this. So I'll start with you, Holly. What do you like the most about Aspen Dental? What's your favorite thing?
Oh, my favorite thing.
Is it me? Just joking.
I honestly, I'm all for patient care, like 100%. That's what I show up to work for every day. But I would say it's honestly my team. And that comes from not only my home office where I was clinical, but my entire territory that I cover now, every single person I work with, they're all such amazing and genuine people. Like I have never come across someone in Aspen that I like dislike their personality or think that they're a bad person or anything like that. I just genuinely think everyone shows up to work with the intent to give patients the best care possible. And like I said, I cover 32 offices, and every single person I meet and walk in, and if they're having a bad day, they're having a bad day, but they still show up with a smile on their face. And to me, that says more than anything.
That is awesome. Yeah, I think that's really very true. I think that's an Aspen culture thing too. People are just really open with communication. And when you're really open with communication, it allows for people to be themselves. You know what I mean? And I think that allows the focus to be on the patient, because we're honest. I mean, we're not going to treat the patient like we're having a bad day, but it's okay if you're not having the best day. And you can tell your manager, hey, I'm not having the best day. Or you can, you know what I mean? You can be you. And I absolutely love that. Okay, now on the flip side, what do you like the least about Aspen Dental as a company? You're like, thanks. And I think you need it.
Yeah, I might need a minute because that's a tough one. I mean, there's not really anything that I'm like, oh, I just really don't like this. Yeah, let me think. I'll let Natalie share her favorite thing.
Okay, Natalie, share with me your favorite thing.
I'm gonna copy Holly. The team and the atmosphere of Aspen Dental is my favorite thing. Like I said, I fell in love with just from the second I walked into the door for my interview and saw how they were running things in their office and how they treated patients, and the conversations that I heard were just, they won me over. But another thing, probably right there with the team atmosphere, is the autonomy that Hygiene has within our world. Again, just being able to really treatment plan a patient for what we genuinely think that they need. I know that that does not happen everywhere in the hygiene world. So I really, really appreciate that with Aspen.
Cool. I'll give you a second to think about your least, and I'm going to share my favorite and my least. So my favorite by far, hands down, it's the thing I'm most obsessed with. It's career growth for people. I have always been obsessed with hygiene careers forever. I've done many different things, from public health to sales to clinical. And I like that you could start at Aspen and go into so many different avenues if you choose to. And I think that that's empowering, and it's something that I don't see everywhere else. I love DSOs, and I think a lot of DSOs are trying to do right by people, but I feel like Aspen in particular, as a DSO, looks at hygienists in every role that we add. So whether it be the ortho team or the executive leadership team, there's hygienists all the way through. And I know with some it's not normally like that. They'll be just like maybe a hygiene VP or like one or two people up there, a couple trainers and a hygienist. But at Aspen, it's like many roles. Like if I go into listing them, like I can go and go and go, where usually you can't. So I like that. If somebody has an interest in something, I've had hygienists tell me they wanted to do HR until they looked into it, and then they didn't want to do HR. So I've had hygienists tell me like a lot of different areas that they were interested in. And I was able to link them up with someone who was an expert in that area, so they could learn more about it, see if that's something they wanted to go for in the future. It's helped people as far as like whether or not they would have to, I've had people who wanted to get their bachelor's in certain things that maybe didn't make sense for them. But then after they met with people who are doing those roles, they kind of could make a decision for themselves. Like, is that something they want to do or not? So that's my number one favorite and that's obviously why I work on the academic team, because I'm passionate about getting people into what I think is the best career in dental hygiene. Sincerely believe that. I will tell you, and you guys don't laugh too hard, but my least favorite thing, it's kind of like a good and a bad. It's like a double-edged sword. you will get challenged because we will bring new technology. We're going to have new technology for our patients. We're going to have new equipment. We're going to have new things. So like, if you kind of like to hang out, which sometimes I can be in a bad habit of, sometimes I would be like, not another new thing. But then once I get to know that new thing, but the process of learning that new thing. So for example, like when we brought in iTero scanning, at first I was just like, this is so much work. But then I realized like the impact it had for the patients and other things like that. So I will say it's like, I like it. And I also, when I lived it, it was a little different. I would say like the new things that come up will challenge you. But if you can go through those challenges, you're really doing the best thing for your patient. Holly, did you think of anything?
Honestly, my least favorite thing, it's not even anything to do with actually what Aspen does. I think that my biggest frustration is Aspen just gets labeled so quickly as corporate dentistry. And it really,
Yes.
really frustrates me because most offices are owned by a doctor. So even though they say Aspen Dental in the building, that doctor is the one who's in there and they genuinely care. And so just when Aspen gets slapped with that label, honestly frustrates me so much because people just have this idea in their head of what they're to, and it's just not right. And I even battled that when I went through school and I graduated and people are like, oh, you're going to work for corporate. And it's like, no, I'm not. I'm working for my doctor who owns my office. It just has a name on the building and I get to have all these resources that Aspen provides. So that would be like my biggest
It is.
negative about it.
I would agree because sometimes you have to explain to people like, no, like they're not a corporation. These are the things, the reasons I like it. Or yeah, it's that's a really good one. I totally agree. That can be a big frustration in all of our roles when we're talking to people and we're like, no, like your dentist owns it. No, they don't tell you how to practice. They can't. Like that's not what it is. So really, really good point. Natalie, did you have a least favorite?
I was honestly going to say the same thing as Holly. I feel like sometimes when I'm discussing my treatment plans, people are just feeling like we're corporate and I'm just putting a number on them and dollar value and that kind of thing. And I would never want someone to think that I would treat them that way because I genuinely do just what's best for the patient. And so it's frustrating that people come in the door with that attitude sometimes, but I always try to win them over and, you know, explain and educate them and hopefully get them to understand really where we're coming from as Aspen Dental and not corporate.
Yeah. That can be really frustrating too, because we do see a lot of patients that haven't been in for, I mean, it's not uncommon to see somebody, I would say every week, that hasn't been in for 20 or more years.
Absolutely.
Average patient, probably 5 years. So there's a lot of barriers to break down. I always liked that challenge, but it could be a challenge because you're working with people who, you know, didn't have the luxury of doing this. I mean, not all the patients, I'm not generalizing here, but there's some people that you work with that didn't have the luxury of seeing the dentist every 6 months from the time they were, you know, 4 years old. This may be the first time for a lot of patients. And I think that takes a lot of extra. And I feel like I had somebody I used to do what Holly does. And the person who took the role said, wow, we have the best hygienists. And I was like, it's because we have the best patients, the most challenges. So they just learn to be these amazing communicators that you don't see everywhere else. Because you're not running a mill here. You're seeing actual people with actual really strong disease states in some cases. So yeah, sorry, I went on a tangent there. I'm very passionate. All right, so we got through that. Let me go through our next. So this kind of goes to what we were talking about, or what I was talking about earlier. They're asking what types of jobs are available for hygienists down the road aside from clinical. Holly, why don't you talk about the track for the clinical side, and then I can talk about like some of the non-clinical ones.
Yes. You mean like, what do you mean?
I mean, like the step if you were going to go from associate to VP of dental hygiene. Like what roles are on the clinical side along the way? Not working clinically, but like supporting clinically.
Oh, gotcha. Okay. Yeah. I was like, wait, what? Yeah, so get hired on clinically, you are either an associate or you're just a hygienist. And what I mean by just hygienist is you're not a lead hygienist. Once your office hires a second hygienist, you become hygienist. And then from there, you can become what's called a territory manager of hygiene support. So that's what I do. And for like 1, 2, 3 states on the area that you're in. And then you're going into supporting them. Above that is the director. They cover usually territory managers. So we have one West, so she covers Colorado West. So she has 3 territory managers that she covers. And then over all of those directors, we have our VP of hygiene, which is, and then they have one of those for the West and one of those for the East. And they are able to just support all the directors who support the territory managers who support the hygienists. So you really just have this whole ladder of people who are able to, give you information, give you insight. I mean, like our VP of hygiene for the West, she's a pro at the laser. She helped design one. So you really just have all these people and all these opportunities to grow and to help support you.
And they're very realistic early on. Not to age everybody, but how old is your manager who is in charge, who's a director of dental hygiene? I think she's like, what, 30, 32?
Yeah, she's in her early 30s.
Yeah. And how old are you?
I'm 24.
Yes. So the reality is that these are very realistic for everyone. And in fact, the person that is your manager is really benching to be the next VP and
Yes.
might be a VP before 35 or 40. Well, depending on if the role opens, but she's getting that training along the way, which is what we do, is train those people who are interested along the way to be, we call it benching, so that that person's ready for the next role. Natalie, I've got you on mute, but it's not because I don't want to talk to you. It's just because I was getting some back feed. I will mute you in just a second though. So I'll talk about some other roles that hygienists take on at Aspen Dental. So Aspen is huge and we provide a lot of services for the dentists that own our practices. So the dentists own the practices and they really use us as a service to them. So the services that hygienists are involved in include my role, like an academic who goes into schools, talks about Aspen. We also have our most successful recruiters are actually dental hygienists, both on the doctor's end and on the hygiene end. We have hygienists that are academics for dentists specifically. We have hygienists that work on our ortho team, both in the supportive, like big picture, designing what this looks like across the nation, and as the working in the field with supporting our TMHSs. We have hygienists that are VPs of operations, so not VPs of hygiene, but VPs of operations. We have hygienists that are regional managers. We have of operations, so not clinical, they're working on the operation side. And we have hygienists that are managers of the, or are directors of operations. And then we also have hygienists that work in kind of our marketing areas. I've had hygienists interested in, but did not choose to go through with things like HR. We actually have a hygienist who's in our learning and development department. Those are just a few of them. And what I can say is Aspen is always growing and always changing. So it's not uncommon to see something pop up. And when that does pop up, sure as rain, they're going to have a hygienist. They really people who are confident and understanding of the entire business. And I think that's unique to the other company. And I'm super passionate about it. So that's why I talked a long time. Natalie, do you have any idea for you and your future where you see yourself? Are you loving clinical? Are you thinking of anything long term?
I do love clinical, but I know that someday I will probably start looking into those other options. And I love that it is an opportunity through Aspen. I don't know how long I'll do clinical, but my body's already like hating me a little bit just in general from before I even started hygiene. So I'm sure I'll get there someday.
I love it. I love it. And the good thing is that day can be 10 years from now. I had a hygienist that worked for me that worked in a practice for 10 years. And 10 years later, she said, hey, I'm interested in doing something else. And we started to work on what that looks like for this individual. And other people after 2 years say, hey, there's stuff I want to do. So wherever you're at, that's where your TMHS will meet you and give you those opportunities to expand. And it doesn't always have to be with Aspen. I mean, I'm sure Holly will attest. I've had hygienists who tell me, hey, I'm really interested in teaching. And that's what I want to do long term. And so I would give them opportunities to, at our annual meetings, like teach. Okay, I'm going to give part of this to you so you can have a lesson underneath you. It won't be like a formal lesson that they would have in school, but you've spoken in front of a group. You taught everyone how to use, I think the one that we did was Atrodox. A lot of people were confused on how to use Atrodox. So I gave this person like a clinical opportunity to train other people because that's what they were interested in long term. They're still with us, but we're very supportive and open if other things come along the way for them. I think that open communication is just so important. And we actually have Aspen Dental hygienists that teach clinically for the school up in Coeur d'Alene too, right?
Yes, yeah. We have some who teach, in Idaho, and I mean, they work in the evenings, and we just work around their schedule. They're, like you said, they're just super open with us. They say, hey, this is something I do on the side, and so we just work with them. And during the school year, they are able to go do that, and it's really great. And then we also open up then the opportunity to those students to come into our practices and to learn and shadow hygienists. So it's like a well-working relationship.
Yeah, that's one of my favorite relationships I think that we have with schools is that one, because the school, I flat out met them at the ADHA meeting a couple of weeks ago, 3 weeks ago now. And their director came up and said, I don't think I would have a program if it wasn't for Aspen. You're being very, very kind because she didn't, it was a really rural area. They didn't have anybody and they also didn't have space and we gave it all to them at no cost. So I think that's a really cool partnership and another way to help hygienists grow. I love it. Okay, so this next question is, are there any sort of protocols that is found in every Aspen office? As far as, I think that they might be thinking like perio protocols. And I would say, obviously no, that's set up by our individual. But are there any like, really it's owned by the individual doctor, so there's no protocols per se. The only thing I can think of, and Holly, you can help me out if you're thinking of others, is like things like if somebody gets a stick, there's a protocol to go for and how to report that to make sure that that person gets to the care that they need right away. So there's a lot of safety protocols that are put together by our health and safety team.
I would just say pretty much all Aspen Dentals do like new patient exams the same. So the protocol for that is the same. Like a patient always gets perio charted. I don't know if they're talking about clinical protocols, but and then like clinically, a lot of things are typically available to every hygienist. So things such as locally applied antibiotics, lasers, scanners, the Nomad wireless x-ray machine. So I guess on the clinical side of things, that's pretty like even across the board. But as far as like other protocols go, I'm not, like you said, there's safety protocols in place. But that's pretty much it.
Natalie, any protocols in your experience that you can think of?
No, Holly mentioned them all. And then obviously the support team, I'm sure no matter what Aspen Dental you work at, you have the same support in your territory and region. So I don't know if that's considered a protocol, but that's one thing I love is that I have such great support behind me or for questions or, if I'm confused about how to place Atrodox or it's just not working well, I have the person, there are people that I can go to get that. So, but no other like clinical protocols that we have to do this, that, or whatever.
Yeah, I think the only protocol that I can think of, and it kind of is what Holly already said, is that you assess every patient every time, which really is the standard of care. I don't know. I don't know that that's
Yeah.
but it's not just probing. You got to do recessions, you got to do furcation, you got to do bleeding points, and
Right.
all of that really protects your license, but it also protects that patient who's going to get treatment, and then their insurance is going to ask why they're getting that treatment. And if you don't have someone that's really documented those things over time, it can present more of a challenge for the patient. And so we're just doing right by them as far as that's concerned. And then of course getting, full x-rays and things like that if you're diagnosing, or if the doctor's diagnosing that day, and clinically sound x-rays. So making sure that we're getting all the roots, we're getting everything for the patients. But I don't know that those are protocols. I feel like that's more just like a standard of care.
Yeah.
I
I
just thought of another one. We do a hygiene onboarding program. So hygienist goes through what we call HOP, or people call it HOP. And whether you do it in person, right now we're not because COVID, but you do it online, and it's a 2-week course. You're able to just go through and really learn the ins and outs of like Aspen's, technology, software, everything like that, office kind of ins and outs, how it flows. And then you actually go into an office with a hygienist, follow them around, and you're able to, start doing things clinically with a trainer. Natalie's one of our trainers, so she has a hygienist with her this week. And that's across the board. We do that for all hygienists, and it just is a nice little grace period between school and patient care.
I love that. And if you're a new grad, or if you've been with us 23 years, you're going to go through the same training. Natalie, can you talk to us a little bit about that training and kind of what your motto is, or what you do during that training, that 2 weeks for our dental hygienists?
The first week is a lot of classes online and meeting with vendors and things like that. So I am really just working with them in the beginning with our software system, because it's, different and most people don't have experience with it, and getting them familiar with that, and just kind of guiding them how my standard of care is, how our office standard of care is, and then really supporting them while they transition into starting to treat patients and treatment plan patients and managing a schedule and that kind of thing. So I work in a pretty fast-paced office. We're very busy, which I love, and so I am just there to support them along the way and help them in any way that I can.
I love that, because I remember my first training. It was a 10-minute morning huddle and go. I was absolutely convinced that somebody was going to figure out that I didn't know what I was doing. Yeah. So I like that. They get a couple weeks training before they get going. And if they need more, that's something we'll always work with them on. One thing that we always get asked, and I like to ask it for people, is how do hygienists determine how much time they get for each procedure? Or how is that determined? Like, does Aspen tell them, or who tells them?
It's really just clinical preference. So we obviously follow the ADA guidelines. So they say 30 minutes per quad for SRPs. So we follow that. You're not going to ever see an appointment that's far less than that. But we really do follow the clinician's preference. So if a clinician says I need an hour and a half for a half mouth versus an hour, the office works with them on that, obviously within like a realistic guideline. But especially when we have new grads or new hygienists to the practices, we give them plenty of grace period, time between patients, and definitely work with them on that. As a new grad, I started as a new grad with Aspen. I never felt like I was being thrown into a schedule that I couldn't handle. And I never felt like someone was telling me how long it would take me to treat my patients. If I said, I'm going to do a full mouth SRP and I'm going to need, 2.5 hours to get it done because it's going to be a hard one to get it all done in one go, no one's going to tell me not to do that.
Yeah. And that's even happened to me, where you go in and you thought it was a certain amount of time, but it's going to be more. The offices work with you for that. And yeah, you get to schedule your own preferences, and that's how your schedule will work based on whatever preferences you picked for procedures. So I always like to ask that because people always think that they're going to be thrown into schedules that they can't handle, and they're going to be jumping from one op to the other and doing all this crazy stuff. And it's like, no, you're going to get as much time as you need for your patients. That's what we do, within reason, And if it's not reasonable, I would say someone will work with you there and help you get reasonable. And I know when I started out as a new grad to do quality work, it would have taken me a little more time. And then as I progressed, I think I would have done more of a normal schedule. So I love that. That's one we get a lot, and students are always curious about that. The other thing is what do students do, or I'm sorry, what would a new person do to get instruments, supplies, like how is that managed?
So that is the office. We have a supply requisition system, and the hygienists are in charge of all their orders. So if you really like your posterior sickle and there's not one in the office, you're going to get one ordered, and no one's going to fight you on it. No one's going to say, hey, you can't order that. We had an office that the Cavitron broke. We weren't just going to tell them to hand scale. We ordered them a brand new Cavitron. So Aspen gives you everything you could ever want and more. I just had a hygienist who wanted a saddle chair. So the regional manager ordered her a saddle chair off of Amazon and got it delivered to her office. So we definitely work with them. You're never going to feel like you don't have what you need to give the patient adequate care.
Yeah. And you get to pick what you want. Even as far as fluorides and things go, we'll always share best practices with you so that if bonusing is something you're interested in, you'll be able to do that well. But if you were like, nope, this is my favorite fluoride in the world and I don't care, I'm going to use it no matter what, then use your favorite fluoride in the world. That's not a big deal. You get to pick your supplies. Natalie, anything that you love in your supply list that you can't live without?
Oh, I love the relief system. Sorry, there's some construction going on, so I hope there's not too much background noise. The relief system is a high evacuation system, and we started using it since COVID hit, and I used it in hygiene school. So when we were able to incorporate it, that's the one thing that I was like, I had the opportunity to choose what system I wanted to use. And but I just love that I have the opportunity to pretty much within reason get whatever I want or need. It's been, I do all the ordering for my office. And when I started there, a lot of the instruments were very worn and could no longer be sharpened. And I was able to start ordering new ones and getting the things that I needed and that could be sharpened and used efficiently. So I love that that's in the hygienist's hand on what we order.
I think that's what we talk about when we talk about, the hygiene is its own separate business. You're running your own business, and part of that is knowing what supplies you need. I mean, there's always someone there to help you if you really don't know what to do, and that's part of the training. But there's a lot of autonomy. You get to pick what you want, so I absolutely love that. You just perked up my mind about technology. So share with me, and I know there's a ton, your favorite technology at Aspen. And I know it's always changing and we always get new stuff, but
this one for me, I would say I love the iTero. Like when I started, that's what you're meaning, right? What we have.
Yeah.
Okay. When I started working there and I saw that, iTero 3D scan image and everything that it can do, I was like sold instantly. I went home and told my husband about it and he was like, that's cool. And I was like, no, you don't understand how cool it actually is for patient education and being able to look at different areas of the mouth that they may not be able to see just looking in the mirror, or even when you're trying to hold a mirror and them hold a mirror and show them. I love that. And then now the laser that we have, I am totally obsessed with, and the results that we get with that. So I couldn't choose one or the other.
I love that. I love that. I will never forget when we first introduced the iTero like 3 years ago or something like that. I used to teach, and I called my former a friend of mine that still worked at the school, and I was like, oh yeah, we've got this. And she literally was like, that changes everything. Like that changes everything. Patients don't have to, like you said, look in a mirror and a mirror and a mirror, or you don't have to try to figure out. I struggled with getting good quality photos with a, what do you call it? Intraoral camera. And mine always broke, like literally the thing worked for me. So I was really excited with it. And it was really interesting to see my friend be like, yeah, that's going to change everything. When a person sees a 3D image of their actual teeth, you don't have as much explaining to do because they can really see what's going on.
Yeah.
At an x-ray, we understand x-rays because we're dental professionals, but patients, I've literally had patients tell me they look like, guess.
Toes.
Yep. You've gotten it too.
Yeah.
Holly, do you have a technology that you enjoy the most with Aspen?
Mine are the same as Natalie's, but I always tell people, Aspen's like that cool kid at school that always had the latest and greatest stuff and you wanted it. And that is literally Aspen. So now we're, rolling out Trio scanners, which is kind of like iTero's big brother. And I'm sure that there's offices out there that are like, no way, we're not going to get that. And Aspen is literally the cool kid that is going to show up with them in all their offices. So it's just really cool that whenever there is something available, they're doing everything they can to make it happen.
I love that. I remember I did work at an office that had a scanner, but hygienists were not even allowed to like breathe on it. Like we had to stay away from it. That was doctor's machine. We only use that for when we're doing ortho. We don't touch it or look at it or get near the cord or anything the other time. It's locked in his office, like literally. I'm not making this up. That is exactly how it was. And that's comical to Aspen because you guys know you wheel that thing around every hour. So it's funny to hear that was something that the hygienist wasn't supposed to touch because it was too fancy. So we're winding up here. I want to make sure I don't have any more questions, but I do want to kind of go through. I know, Holly, that you have some openings in your area right now. And I did talk to Cameron, I'm sure you're the same, that you are considering or would absolutely consider December graduates, because I know we have a few of those that are coming up. So yeah, can you talk to us about what's available now? And then, there can always be stuff in the future too. So I don't want to discourage people. If we don't name your exact area, get a hold of us because that could change. Or if we meet you and just fall in love, we can make space. So Holly, go ahead and share what you got.
And we're talking general greater Portland, right?
General greater Portland. I think most people that I've talked to at the school are interested in staying in Portland.
Okay, so in Oregon, I'm just looking at my little list right here. So we have full-time positions open in McMinnville, Oregon. We have an associate position open in we have an associate position open in and then in general, our Portland area needs hygienists. So like whether you want to be part-time, float offices, if you really want to like, try out a couple different providers and you want to be like part or full-time, but in a couple different offices, we have that position open. And then just a little bit more south, we have positions in Bend, Grants Pass, and Springfield. So there's tons of opportunity in there.
You said Gresham, and what was the second one you named?
Clackamas.
Clackamas. Okay. It kind of like came out for a second. So I was like, I'm not sure if they heard that. So no, it's not your fault at all. So very cool. Very cool. So what would be the best way for a student to get a hold of you?
You guys can email me or text me. I'm pretty flexible. So I don't know, Emily, if you're sending out my contact info, but or I can share that. But either way, I'm a texter or an emailer. I'll get back to you both ways. If you want like an instant result or instant reply, if you text me, that's the quickest way. But if you want to email me like resumes, questions, whatever it may be, you can definitely do that too.
That's awesome. Yeah, I'm going to share the link with all your information. And then I'm also going to share a direct link where students can even set up an interview with Colin or a screening interview with Colin. So you can literally pick the time. You literally click on his name and then pick the time that you want to interview. So, and if you have any challenges with any of that technology wise or anything like that, you've got all of our emails. We're more than happy to help you. So I have to say, I met this group for dinner, I don't know, a couple of weeks ago. Super fun. You're going to meet some really, really great people. And they have pretty good taste in food too. All right. So I like to always end with kind of a fun question. Holly's like, oh, I know what the question is. She's told me before. So give me one word to describe your experience at Aspen. Holly, I'll let you go first.
Every time you ask it, I'm super ready, and I always know it's coming. My word I feel like would be in the most positive light ever changing. I just feel like it really is. And that's just the world of dentistry. We're always growing, we're always changing. And also you're always seeing different people every single day. So each experience is completely different. So I'd really say ever changing. Even if your, position in your career and your office and your doctor is consistent, everything else fluctuates. And it's just a really great opportunity to be flexible and learn new things and kind of grow and really succeed.
I like that. That was a new one, and it was a good one. Natalie, we gave you a split second. So one word to describe your experience at Aspen.
This might sound kind of cheesy, but I would say caring. I feel like every person that works for Aspen Dental is so caring, literally treats everyone, whether they work with them or it's a patient or whoever comes into our office, like family or like a friend. And I just think that that's what really Aspen has, just a strong caring system for the world.
Oh, I love that. That's the first time I've gotten caring, but the way you described it was absolutely perfect. I love it. For me, there's so many, I change it all the time, but I would say like happy. I was kind of at a point with my career where I wasn't seeing what I wanted out of my future or out of people I worked with, not in a negative. I mean, I had great people. I don't want to be negative, but we were kind of stagnant. And I guess with Aspen, I'm just so happy because I know that I'm constantly going to see different things. People are more innovative than me, and they're going to come up with these great ideas. And it makes me just genuinely happy to be here, to see people treating their patients the way they should be, free of like judgment. They're judgment free for their patients. And there's just a lot of support for hygiene. So it just makes me happy. And yeah, that was kind of dorky, but that's true. All right. Well, we are just about up. So you guys, thank you so much for your time. I really appreciate it. It's always helpful to share with the students your experiences. I think it means a lot to them. And then I really look forward to sharing this. I'll share it with you guys too. And I hope you all have a fantastic evening. Thank you so much again.
Thanks for having me.
Thank you, Natalie.
Thank you. Bye.
Bye, guys.